Stop being wrong with Dad.
This is for making us clean our rooms. Whew. Mommy, what should we do now?
We can eat all the freeze-dried cookies.
Yay, boy! Get off me, Naomi! Help! Help! Help!
Sorry, Dad. Are you okay, Dom?
No, but it got me pretty good there.
That's not good. What the heck got into Dad?
Remember that one day he said that he was going to get supplies and food from the warehouse. And maybe he probably brought the zombies in here.
Mom always said Dad never listened. Dom, you better let me inspect that bite.
Okay.
Oh man, it's all green and foamy.
Naomi, listen to me. We only have 10 minutes until the zombie venom spreads and I turn into a zombie. Dad told me that he put some antibiotics in a safe place, but that was a few weeks ago.
Where? There's no way we're going in there.
Too bad, you have no other option.
First I have to grab my duck bag that Dad got me.
Oh, he's right there. Move, sucker! Go, Niall! Go! Ah! Get up! Go! Okay, now, yeah, we're gonna take a left turn over here, because I believe it's over there. Let's go. Oh! Ah! Ah!
Did he see us?
No, I don't think so. Hold on, I have a good idea. Okay, let's do this. Okay, go! Okay, now it's somewhere around here. Oh,
Where?
Not this box. Oh wait, no, that's not it. Okay. Oh, right up there! Go!
I'm on it. Dom, I can't find it.
Okay, Naomi, I believe it's like a small teal zip-up case.
Oh, wait a minute. You mean this one I had in my pack the whole time?
What? Are you kidding me, Naomi?
Well, I didn't know.
Naomi, look behind you! Naomi, let's get out of here! We're at Jace medical case.
Oh, sorry, Dom, that we got trapped in there for all those zombies.
Oh, Naomi, I can't stay mad at you. Thanks, Jace Medical.
That's right, kids. Jace Medical saves the day. The Jace Medical Kids Pack, your #1 apocalypse companion. For demonstration purposes only, results may vary. Please consult a physician if you're bitten by a zombie. Side effects may include exploiting one's children for shameless product promotion. All right, so one of the most valuable things after a disaster, worth more than gold, worth more than ammunition, worth more than food, possibly worth more than water, is going to be medication.
A common movie trope that you always see in post-apocalyptic fiction is going to be the guy who needs the medication and he's got to go out on some scavenging run. The protagonist is out there fighting off the marauders so he can get the medication that he needs for his kid. We've seen this in The Walking Dead. We've seen this in Leave the World Behind and pretty much every apocalypse movie out there. And it's true because this is a life or death situation. And most people will do anything under those conditions. What else can you do but make a run for the local pharmacy that you know has already been ransacked? And that's part of the problem. Our supply chain as it stands is on a razor's edge of reliability. If there was any slowdown in international shipping, most of our medications, 80%, come from either China or India. In the case of a disruption of the global supply chain, you are absolutely going to have a disruption in the ability to acquire these types of medications. So it's important as preppers that you have a stockpile. Now, before Jase Medical came on the scene, it was difficult. You had to go down to your doctor's office. You had to haggle with the doctor. You'd have to have that uncomfortable conversation about, hey, I'm a prepper and I'm trying to stockpile medications, but I can't get the ones I want because I can only get them for prescriptions for ailments that I'm currently suffering with. Now, Jase Medical has made it easy to get a variety of medications from antibiotics, 800 different types of chronic medications, pretty much anything short of habit-forming medications you can now get easily without having to do a direct doctor's visit. Jase makes the process frictionless and streamlined. So you go onto the website, you place an order, you add everything you want to the cart, all the prescription medications, you have a licensed physician contact you for a consult. That's included in the price. Typically that can range from $100 to $300 per medication. In this case, you're getting all of that for one fixed price point. They're going to have a conversation with you discussing your symptoms, those conversations that doctors have. Of course, I am not a doctor. I'm not giving any medical advice here. All I'm saying is that this is a service that is available to you. This is a very new service. It's only been around for a couple years. It is always recommended that where emergency services and licensed physicians are available, that you consult with your doctor before administering any types of medication. The purpose of this program is for when you're not able to get that type of acute care that you might need. Now, the focus of this video in particular is on pediatric medication. Now, you may not have children, but somebody who does will be indebted to you and exceptionally grateful if you have the medication that their children needs in a time of disaster. When it comes to adults needing medication in an SHTF situation, that's of crucial importance. But when it comes to kids needing medication, that is invaluable. You can't put a price on it. So Jase has now made it very easy with their Jase Kids Medical Kit case. So there's a primary kit which consists of 4 medications. 3 of them are prescription medications. And then you can do numerous add-ons. Some of those are non-prescription, some of them are prescription. With this program, the reason why it's so awesome is because, number one, you don't have to go down and sit in a doctor's office full of sick people. You don't have to pay a physician's consult fee. You pay one fee for all the medications. Whereas if you're going to a doctor and you're trying to have a conversation, and you're saying, hey, I want some hydrocortisone, I want some EpiPen, I want some ondansetron, I want some amoxicillin. He's going to be like, hold on a second. And you're going to be in there talking with him for hours on end. And I don't know how much of a bill that's going to be, but it's probably going to be a lot. Even though you pay slightly more for each individual medication, you have to consider that you're not paying for all those doctor's visits and the pharmacy fees and the shipping fees and all that. Now, myself personally, I'm trying to build my own pharmacy, okay? So that when the proverbial crap hits the fan, we have everything we need, or if we know somebody who is in need, we can help them. Because just because you don't have kids doesn't mean this is not going to be valuable. It's a worthwhile investment either way. And we know that based on the shelf life extension program, many of these medications, if stored in a cool, dry place, will keep much longer than their best before or expiration dates would indicate. In fact, that is proven by a US military study. You can go and look it up. It's called the Shelf Life Extension Program. Like I said, can see my bug out roll here. You can get these from CanadianPreparedness.com. I am building my own pharmacy, okay? I'm telling you guys, you got to be prepared for everything, because if you've never had a sick kid, you don't understand the anxiety that comes along with knowing that your child is suffering, or worse, that potentially the condition they might have could be life-threatening. Some of the medications that we're going to talk about today can mean the difference between life and death. Others are just to minimize symptoms that are otherwise very uncomfortable for a child, especially under the type of conditions that we're talking about here. Okay, so if you get the Jase Medical Kids case, just the 4 medications that you're going to get before the add-ons are going to be the 2.5% hydrocortisone cream, which is available via prescription only. We'll talk about what that does in just a moment. Also the ondansetron, which can be used to treat different types of nausea. This may have some utility for acute radiation sickness if you're talking about a nuclear kit. And then of course we have amoxicillin, which is one of the most popular types of antibiotic medication. This is in a chewable form. That's something to keep in mind, is that most kids have difficulty swallowing medications. This is going to be in a form that is palatable and ingestible for a child. And then of course you get the over-the-counter children's Advil for pain. So going over these medications, number 1 is your antibiotics. Probably one of the most important things, your amoxicillin for children. You can use the antibiotic to treat various types of infections, urinary tract infections, strep throat, pneumonia, middle ear infections, Lyme disease, and other types of infections, okay? So this is probably gonna be one of the most important things in the kit. Up next is the ondansetron. Many people who are undergoing cancer treatment take ondansetron to manage radiation sickness. This is an anti-vomiting, anti-nausea medication. There may be some applications for acute radiation sickness. That, of course, will develop if there is nuclear fallout and you can't get to a safe place fast enough. You might be exposed to a high amount of radiation. Something like this may have some utility in terms of mitigating those symptoms. Up next is the hydrocortisone cream. This is a low potency topical steroid, and this is for the purpose of treating different types of dermatitis or skin rashes that might arise from some sort of allergic reaction. So this level of hydrocortisone is only available via prescription, so it's more powerful than the stuff that you can get off the shelf. Then of course there is the junior Advil, which is also known as ibuprofen, which is a non-steroidal anti-inflammatory drug, can be used for a variety of different symptoms, everything from pain to headaches to joint pain, things of that nature. Never underestimate ibuprofen, especially if you have to do something physical. If you have to bug out, you might be partaking in some repetitive motion injury, something you have to do post-grade down requires you to do something over and over again. You might get some sort of tendinitis. You know, ibuprofen anti-inflammatories, while they're not good probably long term because you're likely going to keep exacerbating the problem, they are good in the short term to keep people moving in the moment if the situation calls for you to be hauling ass in the moment. So that can be something that just alleviates those symptoms. It's a temporary solution. Those are the main 4 medications that you get with the kit. Now they also provide you with this pediatric case guidebook, which is small, but it's very densely packed and it's very easy to follow. Basically, it gives you a breakdown of identifying what the symptoms are, what the condition might be, and then it gives you the corresponding medication that you would use to treat that condition. So it's very easy to follow. It gives you a breakdown of all the different types of medications that you'll find in the kit. So in terms of the extra medications that you can add on for the kids case, we have the EpiPen auto injector. Now, this is actually a full-size adult EpiPen. You can get the EpiPen Junior, which is going to be used to treat anaphylactic reactions to various allergens. This could be a life-saving situation. So if you have to get one add-on, I mean, the first thing that I'm going for is the EpiPen. That is essential for a first aid kit. Next is albuterol, also known as salbutamol, which is an inhaler for asthmatic exacerbations. So it's just a little miniature inhaler. So again, your child might not have asthma, but this is something that you might want to have in your kit. So this is an inhaled medication that works by relaxing the muscles in the airways, which increases airflow to the lungs. I've had situations where my children have had trouble breathing. Again, I don't know if this is something that is going to be useful in that case. Hopefully you have somebody who's a nurse or a doctor who will be able to make that determination. But again, it's just one of those things that requires a prescription. And if you can have it and somebody needs it, it could be a lifesaver. Up next is ofloxacin, also known as ciprofloxacin, which is a type of antibiotic for the purpose of ear drops and treating ear infections, also known as swimmer's ear. My kids have had this on several occasions. If not properly treated, it can lead to hearing loss. So definitely a useful thing to have in your kit. Up next, we have the sulfur sulfadiazine. This is a topical antibiotic. As far as I know, this has been shown to be more effective than the triple antibiotic ointments that you can get over the counter. So this is something that's only available via prescription as well. Silver sulfadiazine. You might want to add that to your kit. I know preppers love silver, so why not? Next up, we have oseltamivir, which is also known by the name Tamiflu. This is an antiviral drug which can be used to treat influenza. It works by helping the body kill off the influenza viruses. Now, I don't know if this is going to work on all viruses. I think this is more geared towards like the swine flu and the what's commonly understood as the seasonal flu. Perhaps not bird flu. Maybe it can help alleviate those symptoms. I highly doubt it, but this is something that's definitely still worth having. There's always a mad dash for this stuff when, you know, a pandemic comes around like swine flu. Everybody's flocking to Tamiflu. So it can't hurt just to have it. If somebody is extremely symptomatic, I mean, why not? Up next is something similar to hydrocortisone cream, and it's called triamcinolone cream. It's a medium potency topical steroid. That's about all I know about it. I'm going to be brutally honest. I presume it's to treat similar types of dermatitis reactions that might arise from some sort of allergen or some skin condition. Next, we got loperamide, also going by the name of Imodium, which is an antidiuretic medication. In the same way that your ondansetron might treat some symptoms of that acute radiation sickness, maybe a medication like this, especially if you're eating crazy stuff, if you're getting stomach bugs, maybe the water was not purified as good as it should have been or not filtered properly, you could have different types of stomach infections. And for that, you get your loperamide, and that might manage that diarrhea, and that could, in some cases, mean the difference between life and death, because if a person can't hold fluids in, then they become dehydrated. Up next, we have over-the-counter stuff like Reactin that you can, of course, get, just another antihistamine. And of course, we got children's Benadryl, which we use all the time in our household. When you buy the kit, it comes in a little case. I would strongly encourage people to stock up on the antibiotics. And then, of course, if you do have chronic medication, check out the Jace Daily program. They have 800 different types of medication that you can choose from. You can stock up. You don't have to have that uncomfortable conversation about how you're a prepper and you realize that World War III is on the horizon and you're trying to stock up. You just go on the website, throw it in the cart, have that quick doctor's consultation, bada boom, bada bing, it's done with, and you've built yourself a nice stash, a nice prepper pharmacy that is going to set you apart from a lot of people in terms of your level of preparedness. This Jace Kids case is the latest edition, also available now in Canada as well. I'll post a link in the description section below with a coupon code as well. Go check it out, get it while the getting's good. Thanks for watching. Don't forget to like, comment, subscribe. Canadian Prepper out.
The best way to support this channel is to support yourself by gearing up at CanadianPreparedness.com, where you'll find high-quality survival gear at the best prices, no junk, and no gimmicks. Use discount code PREPPINGGEAR for 10% off. Don't forget, the strong survive, but the prepared thrive. Stay safe.